In this section, we're going to talk about different study designs that are commonly seen in the medical literature. The goal of the majority of these studies that you will read about is to answer a research question. Often we're interested in how some exposure, typically a treatment or intervention, is associated with an outcome, for example, health or happiness. There are different ways to answer these questions and different study designs that make more sense depending on the situation at hand. Ideally, we'd have data on everyone, so there would be no uncertainty in our answer. However, this is not feasible typically, and so we, of course, enroll a sample of our target population like we had talked about in previous lectures. Each of the study designs we'll discuss here deal with uncertainty slightly differently and have different pros and cons, and you can look out for these when you're reading the medical literature. In a randomized controlled trial, patients are randomly assigned to a treatment and observed in a controlled setting. While often the randomization process is a bit more complex, you can think of it as a coin flip with a fixed probability of getting assigned to either the treatment group or the control group. Often this is thought of as the gold standard for assessing the relationship between a treatment and an outcome. Let's discuss an example of a randomized controlled trial called the CLOSE trial. In the methods section, there's a description of the design as well as the randomization process. Note that the methods section is often where you can find information like this. Sometimes the abstract is even broken into sections, like in this paper, and often the methods section of the abstract will have what we're looking for. Let's take a minute to piece through their description. This was a parallel group, randomized controlled observer blind trial. Children ages 1 to 15 years with moderate to severe eczema were recruited from secondary care and the community at 5 UK medical centers. Participants were allocated using online randomization in a 1-to-1 ratio to standard care or to standard care plus silk garments, stratified by age and recruiting center. So there's some key words here, and they are randomized, controlled, observer blind, 1-to-1 randomization, stratified by age and recruiting center, standard care, and standard care plus silk garments. From these key words, we can glean that this was a randomized controlled trial. The term blind means that the treatment was not revealed. Studies are double-blind if the patient and the person observing the response to the treatment both do not know the treatment assignment. A study can be triple-blind if, in addition to masking the treatment from the patient and the observer, there's also a monitoring committee overseeing the study that is blind to treatment assignment. In a single-blind study, either the patient or the observer knows the treatment status, but not both. Here, the study is observer-blind, a type of single-blind study, meaning the patient knows their treatment assignment, but the observer does not. Blinding a study is one way to reduce bias. For example, if the observers have a hunch that the treatment is preferable to the control, and they knew which patients received the treatment, they may be more likely to evaluate these patients favorably, whether intentionally or subconsciously. It turns out that many of these keywords could also be found just by reading the title of the article alone. The next keywords describe the randomization process. We know this was a 1-to-1 randomization, meaning that an equal number of patients were assigned to the treatment and the control group. We also know that they stratified the randomization by age and recruiting center. Stratified randomization is a very common procedure where patients are first broken up into groups, in this case by age and recruiting center, and then they're randomized within each group. This is a way to prevent imbalance up front. What we mean by that is, since we have randomized within age group, we know that there will be a roughly equal number of patients in each age group in the treatment and the control group. We'll talk more about imbalance in the reading table 1 section. Finally, the last two keywords reveal the exposure or treatment and the control. Here, the control is standard care, and the treatment is standard care plus silk garments. You can read the full article in PLOS Medicine.